Hi, my name is Paige. I'm going into my second year at the master's program at the Duke Global Health Institute, and this summer I've been fortunate enough to be working with Professor Michael Frax, and we've been looking at state versus federal Stark laws and anti-kickback statutes. There we go, sorry. So two of the most important federal fraud laws that apply to physicians are the Stark Law and the Anti-Kickback Statute. So the Stark Law prohibits physician kickback and self-referral. However, the Stark Law has over 20 exceptions, such as if the referring physician and a referred physician are part of the same group practice. The complexity of the Stark Law has left hospital executives in Congress struggling with the boundaries of the legislation. The anti-kickback statute prohibits the knowing and willful payment to reward patient referrals or services payable to the federal healthcare programs. Joint ventures between physicians and or healthcare companies that are in compliance with the small investment safe harbor are an exception. So in October of 2019, a call for reform of the federal Stark and anti-kickback statutes was announced. However, it was unclear how this would impact at the state level, as currently there is no database that contains all state level Stark and or anti-kickback law equivalents. So my research objectives were fourfold. The first being to determine which states had equivalent state level Stark and anti-kickback laws. The second was to create a database of the state level laws. Third, to compare and track changes in these state laws. And then the fourth was to compare state to federal laws. So I used the Lexis and Westlaw databases to find these laws. So my search strategy was as follows. So my primary database that I used was Lexis, and those were the search strings that I was using. And then secondarily, I used Westlaw to look at more refined searches, and these are the states that I was looking at on Westlaw. So the data collected kind of goes into four bins. So first being a summary of the state laws, then looking at the history and the amendments and exceptions. So I was able to find the state law equivalents, and I created a database that holds all of these state laws. I then looked at the history. So here you can see the progression of the state level Stark and anti-kickback laws over time. So beginning in figure A, in 1935, when the federal Stark and anti-kickback laws were created as amendments to the Social Security Act. Then looking at B, the first state law equivalent was enacted in Montana in 1947. And then every 10 years, you can visually see the increase in green states, which indicates a state level law. So here's a map of the US today, and the blue states indicate those that have state level Stark and or anti-kickback laws. So I then looked at amendments and exceptions together in one bin. So of particular interest was the group practice law amendment. So general exceptions to both ownership and compensation arrangements exist, particularly that the law shall not apply to the following cases. So physician services, in the case of a physician service is provided personally by or under personal supervision of another physician in the same group practice. So the term group practice means a group of two or more physicians legally organized as a partnership, professional corporation, foundation, not-for-profit corporation, faculty practice plan, or similar association. So we decided to track this amendment over time within the state level laws. So this is the result, and I know this is an overwhelming figure, but if you stick with me, on the y-axis, we have the name of the states and the corresponding laws, and on the x-axis is a timeline. So this figure is showing a timeline for each state level law. Each state law is represented by a colored dot, and the first represents the year that the law was enacted, and the following dots represent the amendments. And the group practice amendment is indicated in this figure by the red arrowheads. So as you can see, not all laws have this amendment, and for those that do, you can see that there were different times in which this was amended. So the implications of this research are as follows. So by having a better understanding of the state level Stark and anti-kickback laws, the movement towards value-based care and the current legal restraints of these laws can be considered per state. Further, the impacts of the Stark laws upon current health systems at the state level can be better understood and studied. By building this database, researchers will be able to explore various theories regarding the effects of these laws on important marketplace outcomes. For instance, Professor Frax intends to explore whether group practice exemptions to these laws encourage practice group concentrations. So thanks for listening.
Okay, great. So anyone have any questions for Paige?
And this is Rob. Paige, great
Yeah.
work. I'm curious, I know on the federal side, there's been a number of proposals over the last year to amend and change up the federal Stark law, and kind of curious if you see that leading to states considering similar actions, especially as they think about value-based care for their Medicaid programs.
Right. So I think that was one of the issues that we had identified, that it wasn't really known what was going on at the state level or which states actually had equivalents. So that was kind of the purpose behind creating this database, so that with the attention being brought to the federal level laws, seeing what effect that would have on the state level laws. So do I currently know? The answer would be no. But hopefully this database can kind of be used as a tool to explore that.